Mm. Signals flash through cell membrane gates. Growth unchecked till cancer waits. Confined it blocks EGFR's key. No tyrosine spark, no cell decree. Erlitinib joins the silent stand. Stops lung and pancreas on demand. Rash and diarrhea come in stride. EGFR's price can't hide. Patent plays a dual tone. Hits EGFR and HER2 zone. Breast cells shiver, growth denied, but hand rash and pain reside. Amlitenim changed the fight we know. Stops peak cry, Abel's deadly glow. CML sword now dulled and chained. Signal gone, remission gained. Tyrosine Kinase's frozen cold. Cancer script no longer told, but edema and cramps arise. Hepatotoxic tears disguise. Turn off growth, the signals fade. Receptor chains no longer made. Block the gate, the kinase dies. Cancer's voice no longer cries, but rash and heart and vessel pain mark the cost of the tyrosine chain. Trastuzumab, the HER2 queen, targets breast where growth has been. Antibody bound, it blocks the gate. No dimer forms, no kinase fate, but hearts may falter, weak and sore. Cardiotoxic risk once more. Bevacizumab cuts blood's way, stops the EGF from its prey. No vessels feed the tumor's need. Starved of flow, it can't proceed, but clots and bleeds may cloud the end. Wounds may fail to heal or mend. Turn off growth, the signals fade. Receptor chains no longer made. Block the gate, the kinase dies. Cancer's voice no longer cries, but rash and heart and vessel pain mark the cost of the tyrosine chain.